Hello, my name is Janice Karen. I'm the Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. And if you'll go to the first update, please. NCQA just put out a notice, I think yesterday, but certainly this week, that they are extending the reporting window for measure year 2023 until June 28th, 2024. This is a response to the Change Healthcare attack in case it slowed down access to any of the necessary data. So the extensions include all of the HEDIS reporting for any health plans that send results to NCQA. You don't need to be a customer of Change Healthcare, and also for patient level detail files for Medicare contracts. They also intend to have some follow-on extensions, though they haven't announced the specifics yet, for products that use the HEDIS data, including Quality Compass, the health plan ratings, and health plan accreditation. There isn't a lot more information out there, but if you'd like to, you can follow the link to see basically what I just said and get a little bit more information. Any questions there? All right, well then let's move on to the next page. The Office of Minority Health has put out a very short RFI on developing a universal symbol to indicate language assistance services are available. Any comments are due by May 20th. It basically asks, almost the entire RFI is on the screen, what organizations are doing to let folks with low English proficiency know services are available, how effective the methods are, and whether you're using or know about any standard symbols or other standards around communicating language assistance services. You can find a link to the RFI in the Federal Register below, and it's kind of it's a very niche, small thing, but it's an interesting thing to look for standards on. Any comments or thoughts or questions there? All right, moving on. OCR and CMS have put out the final rule on non-discrimination in healthcare. It was unofficially published on Monday, and it will be put in the Federal Register on May 6th, which is next Monday, I believe. Is it Monday or Tuesday? Monday. So this is a follow-on to a proposed rule that we commented on last year. And it's basically outlines some enforcement as well as some new rules around non-discrimination standards for any payer or provider or other entity that receives federal financial assistance of any sort. And so they're specifically highlighting that this holds true for HHS health programs. It also holds true for educational things, and that was also in the proposed rule. But it basically, some of the specific things that they highlight, I haven't had a chance to look at the final rule, but some of the specific things that they highlight are that all providers and payers and others are required, following on the last RFI, required to let people know that both language assistance and accessibility services are available at no cost. Also, that all telehealth programs and activities must be accessible both to people with limited English proficiency and disabilities. And it clarifies that the non-discriminatory healthcare provisions apply to payers, not just providers, and that it applies to AI and other decision support. And they also clarify early on that, among other things, discrimination on the basis of race, color, national origin, age, sex, LGBTQIA plus status, or disability are just some of the things that they're not allowed to discriminate for. So we'll take a quick look at the final rule. The proposed rule was really interesting because it made some basic assumptions of a level of non-discrimination already existing that probably is a bit naive, or maybe optimistic is the right word. So it'll be interesting to see if they changed any of that in the final rule. And so that will be very interesting. Anyone have any comments or thoughts or questions there? All right, then moving on. CMS has put out an update on the advanced explanation of benefits rulemaking progress rather. So this is not a proposed rule. It doesn't include any content about what they plan to do or any specifics about what the rules will be. But it's basically, we haven't told you anything in a while, so we're just going to make sure you know that we're still working on it. And just as an aside, according to the last unified update, the proposed rule covering advanced explanation of benefits is not expected until at least March of 2025. So this is still a ways off. But what they've talked about is discussions they've had with people, comments they've gotten on RFIs, and the types of information that they're digesting and trying to take into account as they work towards those rules. So some of the topics and areas that they've been having conversations or getting comments on include the exchange of good faith estimates and advanced explanation of benefits data, the exchange of GFE information among multiple providers. They've talked a bit about privacy concerns and how to represent the surprise billing. This one was interesting. There apparently has been some discussion of exemptions for small and rural providers. It was not clear if it was not just to be clear, this was not something that CMS said they were considering. That, but more, we've gotten a lot of comments on this topic. So there have been pushes for this to be something that they consider. Also discussions around how to best support underserved and marginalized communities, and then some discussion around how to test the system and the need to test it both ahead of time and in real world systems in production. So they talk about, in addition to, they don't really talk about the upcoming rule making at all, but what they do say is that they have currently planned 2 things in addition to the activity ongoing, keeping going on the activities they're already doing. And one of them is looking to support additional provider educational materials on good faith estimates. They think it's clear from some of the conversations and comments they've gotten that there are providers out there who don't fully understand the program and the good faith estimates and either their purpose or what some of the components are. So they're looking to do additional education on that, and I think also to educate providers on the role of the patient and why this is something that CMS is pushing, and that it's meant to be something that helps patients in a variety of situations. So that's one thing. And then the other thing they're starting to look to do is the use of the Da Vinci Patient Cost Transparency Implementation Guide. This is the first time I've seen CMS explicitly mention the implementation guide. This is interesting because it's one approach and it has a very particular approach, which isn't necessarily, it imposes some additional requirements above and beyond the legislation. And there are some decisions. I haven't looked at a very recent version of the IG, but I know that in the earlier discussions around the IG, there were components such as sending AEOBs back to providers that may be something that some people want to do, but that isn't required by the law as it stands, that were standard parts of what they were looking to do. So it would be really interesting to see how that evolves. It is certainly a FHIR-based, standard-based way of looking at portions of the No Surprises Act price transparency requirements. So certainly it's very reasonable that CMS would look at that. And there's no indication at this point that CMS will be adopting it or even recommending its use, but just something that they're going to start looking at as a possibility. So any questions or thoughts there? All right, next slide, please. The FTC has put out a consumer alert about various companies sharing health data in untoward ways. And what they've basically done in this alert is highlighted a few recent egregious cases and then made some recommendations to consumers. There's nothing earth-shattering here, but they're explicitly recommending to consumers that they actively compare privacy protections, the data use and privacy policies when deciding which applications, websites, etc. to use. And also to explicitly review website notices. And what they're talking about here are options for how you can configure websites, choices around not always accepting all cookies, but only accepting the minimum amount of cookies. They don't explicitly say that that's always what you should do, but they basically encourage you to review what you actually feel is necessary for each site. My personal recommendation would be to do the minimum, but be that as it may, and also to customize the information that you share. And this is something there aren't, 20 years ago, a lot of people customized their browser settings. These days, a lot of people don't. But one thing that browsers allow you to do is actually they give you some control at the browser level as to what information gets shared when you visit a website. And so there are certain things that you can block other websites from seeing in certain browsers when you're using certain browsers. And they include things like location information or even your browsing history. By default, there are certain places and ways that your browsing history gets shared. That's how you get all of those one of the ways you get all those intrusive ads. And so they are recommending that folks go into the browsers they use and customize what gets shared to your comfort level, basically, with an implication that many people are probably sharing more than they want just because they don't know they have an option to turn that off. And they don't necessarily understand what's being shared by default. So there's actually two separate documents. The actual alert is the first link, but they also put out a secondary document that actually goes into more detail about the recent cases of egregious misuse of data that got cited in the consumer alert. So that's the second link. Any comments or thoughts or questions there? All right, next slide. And if you'll pause there for 1 second, I hope you learned a lot from her quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen.